All right, we're good.
All right. Okay, good morning, everybody. We're in part of the little healthcare symposium that we have every 3 months. And so we're actually lucky to be able to have in person some people that we can talk to, and most especially Greg Caldwell, who's an optometrist. So as usual, the mantra is the slaughterhouse of failure is not in our destiny. We will persevere, we'll pursue until we succeed. Augmandina, a little modified. So we've got Greg Caldwell over here and Dan in the other room, and we're all in Utah. Greg, Dan, would you like to say anything just to say hi to start?
Oh, hey, good morning, everybody. I'm just glad to be out here. Thanks a lot for joining us. We have the privilege of having Dr. Caldwell join us today on our call, and we'll hear a little bit of his story. We talked to him last night at the bar, which probably wasn't the best place to talk to him because he had a few cocktails in him, but that's okay. We'll get the story here today, and I'm really excited to hear some of those stories he has for us. So thanks for joining us, Dr. Caldwell.
No, the honor is all mine, so thank you.
On the contrary, it was a good place to hear him at the bar, so we got the real truth. Today we're going to hear the official version, but last night we could actually, get to the truth.
That's right. It's
Dr. Caldwell, so we have a couple of questions for you.
Yes.
Who are you?
Who am I?
Yeah. Who actually are you?
I am. I'm an eye doctor that's in Western Central Pennsylvania. Someone that started off in medicine and now is enjoying his second mountain of passing on health and wellness to patients.
And how do you pass on health and wellness to patients?
Well, I won, in a sense, by living it, setting an example. But, about 2 years ago, I introduced the scanner into my practice and scanning patients and basically helping them understand that even if they're fit, their maybe inside or their wellness might not be at 100%. So
let's just go back a little bit, because the scanner is as a consequence of something. What made you become an optometrist?
Oh, wow, that's going way back. I was probably 12 years old, 10 to 12 years old, playing baseball. And while playing baseball, I was an outfielder. I'm left-handed, so I could play first base or outfield or pitch. And I just remember saying to my dad, I'm not seeing the ball like I used to. And so he's like, well, we're going to take you to the optometrist, going to take you to the eye doctor. And took me there and he examined my eyes and then got me a pair of glasses. And the next game or two that I played, I was able to see the ball really, really well. And I thought that was pretty amazing. And at that point, I said I wanted to be an optometrist.
So you had that goal from when you were 12?
I had that goal since I was 12.
Wow.
In Lawrence, I can back that up because there's in my neighborhood, I was quick to learn how to share because I had a neighborhood, traditional neighborhood, bunch of houses, 40 houses in a circle. And there was another boy that had a birthday the same as mine. And so we had to not have our birthday parties on the same day. So every other year we would alternate having our birthday parties. So I learned how to share there. But his mom wrote down, what do we want to do when we grow up? And so, the traditional fireman, Major League Baseball player, professional wrestler, or whatever you want to be whenever you're 12 years old. And she has it documented. Optometrist is what I said.
Wow. And what did he say?
I don't remember. So,
what?
yeah,
I thought you were sharing. You were sharing everything.
I don't remember what he
shared
wrote
the memory. Okay.
So that's really fascinating, that you knew what your purpose was and what your why was at such a young age, because a lot of people, myself included, even at the age I am now, which I'm not going to say, I'm not going to date myself, but I still am not 100% sure what my purpose is. So knowing that at such an early age, and how you wanted to help people the same way that you were helped through vision is fascinating. But one of the things that you said about, helping people become the best version of themselves through health, and even though they may feel healthy and look healthy, educating them on the fact that on a cellular level, they're probably not, right? And that's what it all comes back to. So, having that approach to medicine, because most people aren't used to their physicians looking at, health, overall health, because we have sick care. How do you approach that with patients? And then the second question is, how do they receive it?
Well, Dan, that's a great question. Probably that's something that, I had to develop. And, just sitting here doing this talk, you're saying about wanting to help people. That's probably, probably the backbone of that's probably my why. I want to help people. I want to help people see. I do a lot of lecturing. I looked at my schedule, my Delta app last night. This is my 57th flight this year.
Gee.
I do a ton of speaking. So when I learn things, I want to go out and teach it. I learned this side. I learned about the high quality products, the safety here. I want to spread the word because, in a sense, I poked around for a while to try and find, something that I wanted to recommend and have safety. So I know I kind of derailed your question there a little bit, but I think the why is wanting to help people. I could have slept in this morning and you guys saw me last night, and this is a great opportunity here to keep spreading that why. And I want to help people and help people understand, this mission towards health. Now, your question about how you do it in patient care, there's forms obviously that we use, and the patient starts them thinking about their process. It asks them their interest level, and the ones that are high, those are easy, but the ones that are low, I don't give up on them. It might not be this year, but we might start that changing process. If they're low, I acknowledge it. I say, look, your score is low. And I have a concern with that. I see that your score is low, but I want you to think about a few things. I'm going to see you next year. And, I've been doing this long enough. They come back and they've warmed up to it. I tell the patients, Lauren speaks, 7 languages. I tell the patients that I speak 2 medical languages. I can speak allopathic. I grew up trained that if you have an infection, you use something opposite to cure. So an infection, you use an antibiotic. If you have inflammation, you use anti-inflammatories. I tell the patients, I've done that for 27 years of practicing optometry. But the last, 5 to 6 years, I've learned how to speak integrative, complementary medicine, that language, attended those conferences. So if they're interested and want some guidance on maybe how to prevent, because, one of the things I learned, it's all about early detection. And what about early intervention and true wellness? I know we were chatting the other night about, breast cancer. I just had a friend get early detection, and I said to her, that's why you do early detection. It's going to be a pretty simple process. She doesn't have to have anything major reconstruction, so on and so forth. But just stepping back, could we have intervened any earlier with that health? And that's really where this has become the fun. So, it's become a skill set to learn how to talk to the patients. However, I will point this out. It's not as hard as it would have been 15 years ago. Patients get it. Maybe COVID has helped us out in a sense to be able to address the wellness, address health. But, the patients that are not totally interested, don't give up on them, but you don't have to try and convince them that this is what they need to do.
That's awesome.
So when you get when you get a little uphill from some of the patients, how do you react to that? How do you feel about that? What's your action or reaction to that? Somebody says, no, I don't think this, no, it's not what I want.
Yeah, probably how if you were a patient, Lawrence, I'd probably say, you know what, I was there before. I totally understand where you're coming from. I'm going to give you a little bit of literature. Maybe I'll send you a video or just give you some information. And all I ask is that you read it or listen to it, and that's it. I was there. I mean, I grew up allopathic years ago, right? It wasn't 27 years ago. It wasn't sexy to be discussing health and wellness.
So you're actually patient with the patient.
Patient with the patient. You got it. Yeah.
So you're understanding and patient. Okay. So your passion. This is obviously your passion. Or do you have another passion? What else have you got as a passion?
No, my passion is teaching. So if we just drilled it down tonight, is that when I learn things, I'd like to share it, go out and spread it. I don't need to be the person, like in my area, there's 40 optometrists. Like I don't have to I learned this new skill set. I'm going to try and set myself apart. Let's go spread the word and teach people. That's what I like to do.
So why are you here today? Where are you? Where are you today? Where are you? What are you doing?
I am.
Where are we?
Well, I'm in Provo, Utah today.
Why? What are you doing?
Well, believe it or not, this is like my sixth, if you want to call it fly-in or conference. And I lecture from the podium. Every time I'm here, I learn something, which makes me better to be able to go out and do what I just told you my passion is, go out and teach. The scientists are going to be here today. You are here, Dan's here. We've got Dr. Hamilton that's with us. And, I learn every time I'm here, and it helps me become better. So
Helps me become better. I like that. If we all had a mission to become better, we would not dwell in our comfort zone of mediocrity. Would you agree?
I agree. Yeah.
Because we all live in that comfort zone, and some of it is just mediocre.
So one of the questions that I have for you is, we get this a lot from physicians, and that, I don't want to sell something. I'm not a salesperson. I'm not this, I'm not that. They have these preconceived notions of what offering health and wellness to their patients is, and they don't want to get out of their wheelhouse. They don't want to get out of their comfort zone to kind of expand on what Lawrence has said. And it's, from your perspective, is it selling something, or is it just introducing or teaching somebody about how they can improve their overall health?
Yeah, Dan, that's a great question. As a speaker, I like to try and, answer questions. And if that was coming from the audience, I never consider myself selling anything. You have to go to the grocery store, you have to buy food, and you have choices. I mean, you have to buy a car. Yeah, you have choices all day long. It's just that, are you choosing to buy, processed food? Are you choosing to not exercise? Are you choosing to invest in yourself? So, as an eye doc, we sell contact lenses, we sell glasses. I try to explain to the patients, I see you don't have a no glare on your glasses. These are the benefits. You see that my staff don't walk around without this benefit on their glasses. There are lots of nutraceuticals that are out there. That the space can be confusing. That's why you partner with someone. After doing the research, and I did. I went to about 5 to 6 companies, used my own money, wasn't sponsored, asked to speak to the scientists. I wanted to see their laboratory certificate of analysis. And when you start doing that research, you quickly point you to, who's got the true pharmaceutical grade nutraceutical. So when I talk to the patient and I say, look, this is a pharmaceutical grade nutraceutical, this is the one I'm trusting my license with, that's not selling. So, but you kind of have to get there. So you kind of have to learn.
And when you have that aha moment, because you've done your research, and yesterday we had the opportunity to tour the manufacturing facility, which was fascinating. Then that knowing what you know, right, enables you to want to share that with others within your profession, correct?
Exactly. Yeah. And the patients, the profession, the patients, and surely outside the profession.
Absolutely awesome.
So we're in this in the center in Provo here, and we've also got Dr. Lisa Hamilton, who's an optometric doctor. She's an OD, and she's here as well, and she's actually part of Dr. Greg Caldwell's team. And the team is something that we can discuss at some time. You can see how this works on the Monday, Wednesday calls. We just on the Friday calls, it's about why, the mindset, what makes you think, how you think, and so on. So we could get Dr. Lisa Hamilton, she's sitting here, to give us some little input about what she is all about and why are you here, Dr. Lisa Hamilton? Who are you?
Hi there, Dan. So, well, my name is Lisa Hamilton, and I'm an optometrist. And who I am is always a constant journey of exploration. And I don't know if I have a wonderful answer for that, but always trying to uncover, really trying to uncover information about sort of who I am and life purpose and what we're all doing here.
So why
together.
did you get into optometrics?
This is a kind of a simple story. I got finished with high school, and I went to art school for 2 years because that's what I was interested in. And then I decided I didn't want to have a career in art, and I was getting an eye exam with my own optometrist. And I actually thought, well, this is kind of cool. So I went to work for that group. It was Bayshore Eye Associates in Houston, Texas, right across from, the bar at Gillies where, Urban Cowboy for the Ride the Bull. And I came to work as a technician there, and it was an ophthalmology group. So they have their technicians doing the contact lens fitting, doing the refracting, doing a lot of the things that optometrists do. And but of course it wasn't paying very well. So I said, well, I love doing this work, but I don't want to keep. I think at the time I was making $6 an hour back in 1988. I said I'm going to have to, go to school. I think so. I ended up continuing to work there during the day and took some courses at the college at night. And then there was an optometry school right there in Houston. So I ended up finishing up my undergrad at the junior college and then just transferred over to University of Houston and started working full-time. Kept working there on weekends and ended up working ended up transferring over to Houston Eye Associates and working in the diagnostic center and doing fluorescein angiograms. And so I had already knew how to refract and knew how to do a lot of that when I entered optometry school.
So I have two things to say. One, you were overpaid at $6 in 1988 because you were 4 years old. Come on, you were overpaid.
It's true.
So what are your expectations for today, for this weekend? What are your expectations? Why did you come to this weekend?
Yeah, so I came here to learn more about this product. I do have a personal mission in life for constant improvement, physical health, mental health, spiritual health, emotional health, and financial health, all of it. And I'm constantly wanting to improve and see what can I do better. And nutrition, I've had a eating philosophy of eating, avoiding processed foods and chemicals as much as possible, try to eat natural food, organic food, things with one ingredient,
So on the biophotonic scanner, your level of antioxidants prior to supplements is how much?
68,000.
That's what it's about. The scanner is just a reinforcement of what you should know, which you do, about nutrition. That's why we call it a nutritional lie detector. Mm-hmm. So if you've got somebody like you that scores well and you eat well and you can talk till you're blue in the face, people are not going to listen. But if you show them on something that is visible and it's a visual and it's 30 seconds, wow.
Right.
Is that more or less what you're using the scanner for?
So we just got this into our practice.
Okay.
And so another reason I'm here is to try to, because it does start conversations with our patients, but then I don't really yet have the knowledge base to answer some of their questions. So I'm here to learn more and figure out how to incorporate this in our office. And we have a busy practice. We see lots of patients and they're expecting to come in and get their eyeglass prescription. And it was a little surprising to them to get a vitamin scan. And then the doctors were like, well, how do we talk to our patients about this? And some of them were really receptive to it. Others didn't want to talk about it and actually thought we were trying to push something on them, that they weren't interested in. So we do need to figure out how to work this into our practice in a way that it's embraced by the team and the doctors.
So you said constant improvement, and Dr. Caldwell was talking about that too. Constant improvement and helping other people. So this is a mission that we all have in life, I believe, is to be able to be better at whatever we're doing.
Mm-hmm.
So how passionate are you about this?
Oh, extremely. And, I've been at the same practice now for 20 years and I'm watching my patient base grow older. I've been taking care of the same people for 20 years and I'm watching some of them develop dementia. I'm actually watching my mom develop dementia. And I've got one copy of the APEO4 gene for Alzheimer's and I'm worried about that. So I'm taking the age lock formula and trying to do everything possible to keep toxins, out of my environment, and then talking to my patients about it as well. One of my patients who has dementia, her husband does not. And I scanned both of them and her carotenoid levels were quite low and his were normal. And I was thinking to myself, is there a connection here?
What is normal?
Well, that's a good question. So he was at least up in the green. He wasn't up in the purple, but he was in the green, and he seemed to be doing much better physically. But it is a new concept for a lot of my patients and even myself, just trying to learn the connection between carotenoids and general health.
So you need to figure out a way so that it's not intrusive to the patient, right? Where they feel like they're being sold something and you're just trying to maximize your revenue stream, but also how you equate it to your specific specialty. And I think in optometry, it may be easier to do that than a lot of specialties because there is a direct correlation between this score and eye health. Not that there's not with other health, but I think it may be a little bit easier jump for people to understand that.
Right, especially for macular degeneration. And we've been, selling supplements for macular degeneration out of our practice for a couple of years. And they were not, I just learned about the PharmaNex product in October of 2021. So we were selling MacuHealth, but that's a very easy conversation to have for any of my patients who are taking MacuHealth. And then we do embrace technology in our practice. So we have the AdaptDX by Maculogics, which checks dark adaptation scores. And that has a 90% correlation with developing macular degeneration over the next 3 years. So I really am trying to talk to my patients about let's prevent this. Let's don't diagnose it early. Let's don't wait until we see drusen or signs of macular degeneration before we start to have a conversation. Let's get a look ahead. And then even checking the patients and checking their dark adaptation. Hey, wonderful news, you're normal, yet your carotenoid levels are low. We could still, we're still at risk. So
as Dr. Caldwell was saying, the more knowledge you have, the more certainty you have in what you're doing. So before you were recommending products that you were told were good.
Oh, and they have very specific carotenoids, and I do think that product is good. So my patients who are on that, a lot of them are scoring, in the green. However, I'll say you're
But now you're talking about scoring in the green. How did you score before? How did you know before that they were working? How did you know that those supplements you were recommending actually worked?
Had no way to know. No way to know. Right.
That's the point.
Yeah, right.
You went on a belief system.
Yes.
Well, that you were told. Now you're going to be able to palpate through listening to it, seeing with laboratories and the scientists. This is what it's about. It's about knowing as opposed to just kind of being told and believing. Would you agree with that?
I agree. Yeah.
Yes.
Well, we do everything in pretty much eye care. Think about what we do. We measure someone's acuity, and then we get into a pair of glasses, and we check their acuity. We check their pressure for glaucoma. And if it's too high and they have damage, we lower it. But we just don't say, take this drop and don't check it again. So, we're always constantly in medicine measuring and then seeing the outcome. This just has a much bigger picture to it because, or a different picture to it because it's more about wealth and health and wellness that's out there.
And it really, what it does, what it really does is helps you enter into that conversation with the patient, which you haven't been able to do maybe as effectively before, because they can actually see that their score's low. And then that enables you to have them a conversation with them about how they can improve their score and what that means to their overall health and their eye health.
And when I talk to patients about MacuHealth, I'll say, you're on a formula that is going to help protect your macula specifically, but if your carotenoid levels are low, the rest of your body is not being supported.
Which is what Dr. Caldwell talks about. He doesn't talk about just the eye health. He talks about the health through the eyes, that you can actually help everything else. That's more or less what you say?
Yeah. We always hear healthy eye, healthy body, healthy body, healthy eye. But if you think about the eye, why is there so many diseases? Diabetes is a vascular disease. It can affect it. Dementia, neurological disease can affect it. Rheumatology, skin diseases. The eye is such a cool place because it just overlaps in all of those between neurology and skin and vascular and all of that. So again, healthy eye, healthy body. So, that's where, that's why one of my favorite things is Life Pack, because it's full body. Well, if it's full body, it's full eye. So,
yeah.
So the two things that one of the takeaways is that you guys walk your talk, and this is what it's about, because now you know what you're doing. And the other thing is, the current situation in which one is, I would say your current situation is not your final destination. You had a situation for, you say 20 years, I think you started when there's something wrong with your chronological calculations, because you don't look that you've been 20 years, but that situation wasn't your destination. Your destination may even change now.
For sure.
May be modified. And I think that's what's exciting in life, when we've got something that inspires us to introspect and to look forward and say, wow, I can actually improve myself or do something that will help others and something that will incite my own passion. Dan?
Yeah, no, it's about becoming the best version of yourself, but also enabling other people and helping people become the best version of themselves. So that's what, one thing about this business that I wasn't expecting was it really does allow me to do that, which is fascinating. We met Dr. Lisa Hamilton last night and had a great conversation with her. And she said, oh, what you guys are doing tomorrow, that sounds like fun. Can I come? Now, it wasn't what she thought it was going to be. She thought it was going to be a meditation session this morning. but we embraced her because we knew that she, from our conversation last night, that she had something to give to all of us. And so that's what's fascinating. But I want to show everybody really quick before we wrap it up today, why we're here. So we're at the Healthcare Symposium in Provo, Utah. And if you look what's going on here, we have about 65, 70 people here. About half of them are healthcare providers, and they're all here to learn about the products that we offer, the science, the science, technology, and everything else. So unfortunately, they're getting ready to start the meeting. So we're going to have to wrap up the call because we're going to get kicked off. Scott needs to use the Zoom. But thank you very much, Dr. Caldwell, for joining us today. Lisa Hamilton, thank you so much. And as always, Lawrence Kazan-Cassini, if you haven't been here before, please try to make a trip out here and learn what you can about the products that we have to offer.
Thanks, guys. Thanks, Dan. Thanks, Lisa. Thank you.
Thank you.
Thank you.
Thank you all so much. And thank you to Dr. Greg Cole.
Thank you.
Oh, that's all right. That's